Welcome and thank you all for taking the time to join today's conversation about lessons learned and insights gained from a series of evaluations through LAC READS, Latin America and the Caribbean READS, conducted over the course of essentially the past decade and with support from the LAC Bureau at USAID. I'm really pleased to have the chance to share more with you about the LAC READS initiative, a collaboration between USAID and a host of partners to address what unfortunately has become what we call an early literacy crisis across large swaths of Latin America and the Caribbean, particularly in lower income countries and in pockets of historically disadvantaged demographics therein. Earlier this year, and many of you were present, we convened virtually a conversation about the top line results of the series of impact and cost evaluations conducted by Mathematica and the key takeaways that policymakers and implementing partners could use to help inform regional policies and improve education across the LAC region. And today we're excited again to partner with Mathematica to present a more in-depth view of what we've learned about various literacy interventions in the region and how we evaluate them that not only have the potential to drive literacy advancements in the LAC region, but can help change the way USAID and other donors invest in education around the world. These evaluations used randomized controlled trials, RCTs, to generate rigorous evidence on the impact of various early grade reading programs and to build capacity within local researchers, program implementers, governments, USAID missions, and other stakeholders to actually understand, support, and use these results. Importantly, these series of evaluations were also one of the first of our research portfolios in the region to include estimates of cost effectiveness, which we have come to understand as essential if scale up or replication of programs is meant to be taken seriously. Overviews of each of the impact evaluations, a link to our previous discussion in February, and 2 new briefs on best practices and methodology insights are available to download within the resources tab of your console. Please do have a look. And can we advance to slide 2, program overview, please? Thank you. So to lead off today's discussion, Dr. Nancy Murray, Vice President at Mathematica and the Director of International Research, will provide a quick overview of the 4 impact evaluations. Then my esteemed colleague within the LAC Bureau and a true champion of LAC READS and literacy improvement by way of informed dialogue, Dr. Barbara Knox-Seith, will then reflect on some of the challenges these evaluations were designed to address, as well as the high-level learnings that they have generated for the LAC Bureau and for the region at large. Following Barbara's remarks, Mathematica's evaluation team leads, Camila Fernandez, Larissa Campuzano, Emily Bagby, Julieta Lugo-Gil, and Sarah Liuzzi will share some insights on methodology distilled from across the evaluations, including the measurement of literacy outcomes, evaluation design considerations, considerations related to multi-site, multi-comparison studies, and subgroup analyses, as well as the cost effectiveness of the tested literacy interventions. Following the presentation, we're incredibly grateful to have Dr. Dan Levy, Senior Lecturer in Public Policy at the Harvard Kennedy School, for agreeing to serve as discussant. In addition to posing his own questions to the presenters, he will also look to you all, the audience, to submit questions using the Q&A widget in your event console. A core tenet of the LAC READS initiative, beyond a firm belief in the power of data-driven decision-making, is the recognition that improving literacy in the LAC region is a large and complex challenge that takes a true international community to address. And we consider all of you here with us today part of that community. So again, thanks so much for joining. And Nancy, over to you.
Great. Thanks so much for that introduction, Michael. And a big thanks to you, Barbara, and the rest of the LAC READS education team for all of your support and engagement over the course of this amazing project and body of work. So can you go to the next slide, please, Emily? Thanks. So for the LAC READS evaluations, Mathematica worked with the LAC education team, missions, and program implementers to design and implement evaluations in Guatemala, Peru, Honduras, and Nicaragua of 4 early grade reading education interventions that all had a strong focus on teacher training and support in schools, although the interventions and the target populations varied. Improving early grade reading comprehension was the ultimate goal of all of these interventions. So as Michael mentioned, I just want to give you a high-level overview of the focus of the evaluation, since I'm sure that some of you have not had a chance to read the impact briefs that were attached to the resource tab so quickly after Michael mentioned them. And this will help set up the conversations that we're going to have with the rest of the participants in the panel. So the first evaluation that we designed was actually a 2-country evaluation, Leer Juntos, Aprender Juntos, conducted in Guatemala and Peru, that focused on assessing an early grade reading program focused on foundational reading skills adapted for bilingual communities. So Quechua-speaking communities in Peru and Quiche-speaking communities in Guatemala. This had an in-school component as well as a community component to support reading outside of schools. Amazonia Ley, which took place in Peru, also tested an in-school teacher training program in 2 geographies in the Amazon region of Peru. In Honduras, our evaluation of promising reading interventions tested support to teachers and principals in the use of formative and end-of-grade assessments to improve instruction. In Nicaragua, we evaluated an after-school enrichment program with a focus on reading and socio-emotional development for at-risk and out-of-school students from linguistically diverse communities on the Atlantic coast of Nicaragua. As Michael mentioned, all these interventions focus on the most disadvantaged, vulnerable populations in these countries in fairly hard to reach contexts. Can you go to the next slide, please, Emily? Thanks. So all of these evaluations were guided by the same high-level research questions, but obviously they were tailored to the specifics of each study and each intervention. So to understand implementation, we looked at what services were delivered at the child, educator, school, and or community levels. And for the impact aspect of the evaluation, we really wanted to understand the impact that the program, either in its entirety or important subcomponents of it, had on reading skills and other targeted outcomes. And in terms of cost, we wanted to know what the costs of the program are, but more importantly, are the impacts of the program enough to justify the costs? So we collected qualitative and quantitative data to answer these questions for each of the evaluations, as well as cost data for 3 of the 4 of them. Next slide, please. So this is a very information-filled table, and I'm not going to go through it in detail because we'll be digging into a lot of the information on this table. But I just at a high level wanted to share some information across the portfolio of evaluations that we designed and implemented. So the unit of assignments was actually schools in 3 of the 4 evaluations that we designed and implemented. And we used 2-arm and 3-arm evaluation designs. In terms of the counterfactual, it varied. And that's going to be the focus of a lot of our conversations later on in this session. We collected information on reading comprehension in all 4 evaluations, as well as on decoding and fluency in 3 of the 4. And I think an important message we want to leave you with is that actually all of these interventions had impacts. They didn't necessarily have impacts in all the sites where they were tested, and that's something that we'll talk about more later on in the session as well. The effect sizes where we did find impacts were relatively modest, but consistent with the literature on the kinds of interventions that we evaluated. And these are the impacts that you see on the bottom of the last row of this slide on which we estimate cost effectiveness, which will share some information with you on the cost effectiveness of these interventions as well. So with that, I would like to hand it over to Barbara Naxais, Senior Education Advisor and our Project Officer and Partner on LAC Reads. She's been with us every step of the way over the course of this work, and I'm really excited to hear her share out her reflections on what USAID is taking away from this really ambitious portfolio of work on early grade reading.
Thank you, Nancy, and hello, everyone. I'm going to take a little bit of a step back, thinking back to when we started this project. And Emily, you can stay on the first slide there. When we first designed LAC Reads, we were setting out to add to the evidence base regarding what works to strengthen early grade reading in Latin America and the Caribbean, and especially in those countries where USAID works. We identified an array of gaps where little region-specific evidence was available, and we looked for interventions that, 1, showed promise to have significant impact on reading learning, 2, would lend themselves to an evaluation that would help to fill one of these evidence gaps, and 3, for which there was USAID and host country interest in the evaluation. As part of the impact evaluations, we also asked Mathematica to collect cost data and examine cost effectiveness. At the time when we awarded this contract, this approach was new to USAID. It is now agency policy. Next slide, Emily. With the interventions, we identified 4 areas for learning that you can see on this slide. I'm not going to read over those, but just link them to the interventions. So the first one related to time on task, we looked at through the Leer Juntos, Aprender Juntos evaluation in Guatemala and Peru, which had a community engagement component. For the second gap, we evaluated the Espacios para Crecer, an after-school program in Nicaragua. For the third, we were looking at a program in Honduras that was coaching teachers on formative and end-of-year assessments. And for the final topic, really we got some insight into that from almost every evaluation, but the Leer Juntos, Aprender Juntos in Guatemala and Peru, and Amazonia Ley in Peru particularly contributed to learning in that area. Next slide. So we've learned a lot in this process, and I'm only sort of touching on a few items. There are briefers available and evaluation reports available that go into a lot of depth about other aspects, and Mathematica will be going into more depth on methodological. But I just wanted to share these 4 takeaways today. So the first I've called challenges of moving the needle. When I look at the numbers that we see when we're advancing children's learning, I often feel discouraged. A program that has high impact might increase the number of words a child reads correctly by 6 or 7 words. There are other numbers for others, but that's the average globally for international education interventions. Reading fluency requires 60 or more words per minute, so that seems not so significant. But when we look at the effect sizes of many of the programs, they are meaningful and they can be relatively large. As Nancy said, for the LAC Reads evaluations, they were modest, more in the range of US interventions than the global ones. But that's partly because in LAC we're starting at higher levels, and so you end up with highest effect sizes when you have the weakest learning. So globally, we see an average of just over 6 correct words per minute with a standard deviation of 0.44, which is quite significant. But what I wanted to then say around this is understanding that we're really actually having significant impacts with these numbers really helps us to see that these seemingly small steps are actually meaningful and cumulatively hopefully will lead to real progress. And then also I want to call out the cost effectiveness analysis being really an important piece of this, especially when we're looking at multiple interventions we might choose between, because it helps us recognize where we're getting the most impact for our money. The second point I wanted to call out is around the findings around the community action component in Leer Juntos, Aprender Juntos. We had been optimistic that this could be a way of improving learning at relatively low additional cost, but we found in this evaluation there was no impact for the component in either Peru or Guatemala. And if anything, it had a slight adverse effect. But there were significant challenges with implementation, which make it unclear that this finding would apply to a approach that was better tailored to the context, and that approach might in fact add value. So I'm flagging this because I think this is an area that would be very valuable for future evaluation, to compare, for example, to compare multiple low-cost options for increasing time on task, other ways of engaging community that are better for the context, or other kinds of creative approaches. The third point I wanted to call out here, I'm calling context and counterfactual. It's a little bit of a mishmash of thinking on my part, but we all know that when we're implementing a program, we need to tailor it to the context. It needs to work within the context it's implemented. And so that obviously for evaluation, you want to implement programs that are well tailored so that, and ideally are already functioning well in that context, so that your evaluation is really measuring the best, measuring realistically what could be accomplished. But the context also how it affects the program's efficacy can be surprising and informative, and it really brings home the value of testing programs in multiple contexts, either within a country and across countries. And I'm not going to go into that more because Mathematica is going to be speaking to that later. Furthermore, in order to design a useful impact evaluation, it's important to understand as much as possible about the context in advance. This doesn't just avoid implementation issues that threaten the integrity or interpretation of the findings. It helps us to set up comparison groups that will let us answer questions we're really interested in and care about. And one example, I think, is the Honduras evaluation. We started out thinking we would compare schools that only did the end of grade assessments to ones that did both that and formative, but it became quickly clear in discussions with our stakeholders that was going to really threaten the integrity of the evaluation. And so we changed the comparison groups to the other direction and got really meaningful findings as a result. And so finally, time and effort required for a successful evaluation. This is a takeaway I don't think we can stress too much, at least when we're looking at complex multi-year evaluations such as we did, education where the programs are complicated. We really need to have all the stakeholders involved, or representatives from all stakeholders involved early on, thinking through what's realistic, how the context affects implementation, how it needs to affect the program, and getting their buy-in. These can help prevent the evaluation from derailing. And when we're doing that, just to call out, we really need at USAID to think about allocating sufficient USAID staff time. We need to think about it as we're thinking about the LOE and evaluation implementer timelines, and with the agreements with our partners whose programs we're evaluating, including resources and preferably some clauses that enable them to engage without threatening their other goals under the program. We also should consider the potential need for the implementing partners of the evaluated programs to engage around the evaluation dissemination or interpretation of findings, even after their program has ended. And then finally, for us, even though the need for cost data was anticipated and built in, the evaluators ran into issues obtaining that cost data in some of the cases. And I just want to thank DDI for the recent cost collection tools that will help for future evaluations. But even with those tools, we should be aware that when the counterfactual includes non-USAID funded programs, such as ones implemented by the host country government or other entities, which happen in our Amazonia Ley evaluation, we still may not be able to get that data. Next slide. And now we're going to hear from 5 evaluation specialists who led the evaluations. They will talk about their methodological insights across the 4 themes you see on the slide. Our next speaker is Camila Fernandez. I turn it over to Camila.
Thank you, Barbara. I'll continue with an overview of the early grade reading assessment as an evaluation tool. Next slide, Emily. In 2006, USAID contracted RTI to help the agency measure how well children in the early primary grades acquire reading skills using an early grade reading assessment known as EGRA. EGRA is an oral assessment of students' foundational reading skills that is typically applied at the end of second grade or the beginning of third grade. It is open source and modular. It has various tasks that measure skills like letter recognition, phonemic awareness, decoding, oral reading fluency, and reading comprehension. Different sets of tasks can be administered depending on the specific measurement goals. The preparation of the EGRA for application in places where it is not currently in use is resource intensive and takes time. The assessment must be carefully translated and adapted to the local language, often to the main language of instruction at school. The widespread application and use of EGRA has facilitated the tracking of progress on the agency's 2011 education strategy in a metric with which the global reading community is familiar. Next slide, please. Now, let's go over some of the reasons why evaluations need age or grade appropriate measures of literacy outcomes. Longitudinal evaluations of early grade reading programs require measuring children's skills at different time points, often during years when children are acquiring sequential reading milestones. Because the rate of acquisition of these milestones is not the same across all languages or countries, the instruments to measure key literacy outcomes need to be tailored for baseline and follow-up data collection. For example, at baseline, we used emergent literacy tasks from the EGRA assessment and other emergent literacy tasks that had already been in use in some of the countries where we were working, including simple word reading and emergent writing. To adapt EGRA for evaluations in Peru, Guatemala, and Nicaragua, we leveraged the experience of local research teams and expert consultants who had worked with these instruments before. In collaboration with them, we piloted the adaptation of EGRA for use in Spanish and Quechua in Peru, Spanish and Quiché in Guatemala, and Spanish, Creole, and Miskito in Nicaragua. While EGRA was the instrument of choice for 3 of the 4 evaluations you'll hear about today, there are important trade-offs to consider when deciding what instrument to choose to measure literacy outcomes. Now I'll turn it to my colleague, Sarah Luizzi, who will share with you some of these trade-offs. Over to you, Sarah.
Thank you, Camila. So I'll talk a bit about the trade-offs we considered when deciding what assessments to use for our evaluations. For some LACREADS evaluations, we found that it made sense to use the individually administered EGRA assessment, but in others, it made most sense to use a group-administered national assessment. In deciding which to use, we considered each assessment's cost and availability, relevance to the audience of interest, and measurement goal, among other considerations. So I'll start with item 1 on the slide, cost and availability. As Camila explained, the EGRA must be adapted for the specific language and country context where it will be administered because the acquisition of pre-literacy and literacy skills vary by language and country context. The EGRA has already been adapted for use in 40 countries, so in some cases there's no adaptation to be done. But if you're not working in one of those countries, or if you're working with a new language group, the EGRA has to be adapted for your country. And all of this requires time and resources. We use the EGRA for our evaluations in Peru and Guatemala. A strength of the EGRA is that it can also be used for diverse language groups. In contrast, national assessments may not be available for all languages. For some of our evaluations, we use national assessments, including for our evaluation in Honduras. In Honduras, we used existing national assessments because this was a low-cost option and data were already readily available from the Ministry of Education. However, we had to rely on the ministry applying the tests in the specific grades and years that we needed for our evaluation. And in Honduras, the ministry didn't actually administer the end-of-grade national assessment during our study's end-line year, so we had to administer it ourselves. In this context, it was still a lower-cost option than administering the EGRA. Moving on to item 2 in the slide, we considered audience relevance. We wanted to think about who the audience was for our results and what test results would be meaningful and easy for that audience to understand. The EGRA is a well-known test internationally, which is a great advantage for publishing results for a global audience. Furthermore, the EGRA assesses individual students' progress on essential reading skills, and it doesn't depend on a specific curriculum. In contrast, a national assessment is usually aligned with a specific curriculum. And this is good because it measures what students are expected to be learning, and can also be good because results will be meaningful to local audiences. However, these results may be less meaningful to an international audience, but this can be overcome to some extent by presenting results in terms of standard deviations. Now, looking at the third item on the slide, we also considered our measurement goal. So a key difference here is that the EGRA is aligned with essential literacy skills and tailored for the specific context, but the national assessments are typically aligned with the national curriculum. In the cases of Peru and Guatemala, the interventions focused on strengthening essential literacy skills, which the EGRA was well suited to measure. In the case of Honduras, the intervention was a support for teachers implementing the national curriculum, and the national assessment was perfectly suited to measure progress on that goal. Another factor related to the measurement goal is that the EGRA is flexible enough that it may be used for beginning and more advanced readers. In contrast, many national assessments of reading may be sensitive only above a certain threshold level of ability, which may be too high for some students in some cases. Now, I'd like to hand it off to my colleague, Larissa, who will talk about considerations related to statistical power.
Thank you, Sarah. In this section, we will discuss considerations in making choices related to statistical power. So yeah, next. Maximizing power is a key decision in randomized controlled trials. So how do we measure the statistical power? It's normally by calculating the minimum detectable effect, which is the smallest true effect that the study can detect. And the smaller this MDE is, the higher the statistical power of the study. The goal is to be able to detect small effects. And there is a formula to calculate these MDEs. And the formula has some parameters in it, which are the factors that affect statistical power. So the first factor is the unit of assignment. When we conduct randomized controlled trials, we can do random assignment at the individual level or at the group level. In general, there's more power at the individual level. So if we have a study that assigns 100 students individually, that's better than assigning 10 groups of 10 students. But sometimes we don't have the choice of assignment, right? If an intervention is conducted at the school level so that all the teachers, like in these cases, all the teachers in the schools have to be trained. So we have to assign at the school level, and that reduces our power. The sample size is another key factor. This statistical analysis, normally you conduct MDEs for a range of sample sizes. And you see what MDEs are attained with those sample sizes, and you select MDE that is feasible for the intervention and get the sample size that you would like to have. Another factor is the baseline data. So we collect information at baseline to explain some of the variance of these outcomes. And that is a factor, the R-squared, that allows us to explain, to increase the statistical power. The fourth is the ICC, which is the degree to which these outcomes vary between clusters. These last two parameters are important parameters in the power calculation and depend on context. But normally, we don't have the information we do have from some studies, but in these cases for Latin America, we didn't have the information. So this was a motivating factor for us to collect all these parameters and share them with you. So this is what we're going to talk about. Can we go to the next slide? So we can estimate impacts with a regression model, and this baseline data can increase the statistical power. However, not all baseline increase power at the same rate. It depends on how much information these baseline data have and how much variance is reduced. So the more variance we can explain with the baseline data, the better it is, and the higher the statistical power. And the cost of collecting this data also varies. So we need to consider these two factors when we make the decision as to what data to collect. Can we go to the next slide? So what we did was some considerations of what type of baseline data is the most useful to increase statistical power. So we compared different MDEs depending on different characteristics. So for each set of characteristics, we calculate the MDE and we see how much it changes. And we have three main findings that I will discuss. The first one is adjusting for baseline test scores creates the largest gain in statistical power. Once we have adjusted for baseline, then adding household data provides minimal gains in statistical power. In contrast, adjusting for school level increases power more. Can we go to the next slide? So in this slide, I'm presenting the MDE's change as we include different baseline characteristics. So in this first row, what you see is the minimum detectable effect size for all our evaluations with the data we collected. And we see that for Leer Juntos in Guatemala, we were able to detect a 0.35 standard deviation effect, which is on the large range. So the intervention had to be really effective to attain this effect. In contrast, in Nicaragua, which is the last column, it was a smaller effect that we were able to detect. So it was a more powerful study. We had been able to detect a 0.20 standard deviation. Now, next, yes. If we included in our regressions a pretest for all of these cases, in all of the evaluations, the power was increased, right? The MDE reduced. And it reduced by a lot in some cases. So in Guatemala, for example, we can see that the MDE went from 0.35 standard deviations to 0.25, which is much more attainable, as Barbara was saying. Like on average, the range of effect sizes that other studies have found is from 0.16 standard deviations to 0.30. So it is much more attainable to get a 0.25. And in Nicaragua, again, last column, we see that we would be able to detect an effect size of 0.12, which is, again, very, very attainable. Then if we include household characteristics, so this is the third row, which we had for two cases, which were in Leer Juntos, the MDE didn't change from comparing row 2 to row 3. In Peru, it didn't change at all. And in Guatemala, it just went down by 1%. So, and these household characteristics were many. It was like moderate education of the parents, income, characteristics of the household, and it didn't reduce the MDE by a lot. In contrast, when we include school infrastructure, which is the next row, the MDEs decrease. So in the case of Guatemala, the first row, they go from 0.25 with the only pretest to 0.22, which is the including the school characteristics. The type of school characteristics we're including here are things like what type of water do they have, potable water, sewage, do they have bathrooms, do they have a fence in the school, are the walls painted? And these characteristics we think are picking up things about correlated with the capacity of the principal. Probably more capable principals can have better infrastructure and also better academic outcomes. And they could also be picking up how involved is the community. The community is involved. They want the school to look good, to have a good infrastructure, but they also are care also about the academics. So we think that they are picking up this correlation. And as you can see in Peru, Amazonia Legue, the MDEs go down from 0.34 to 0.15. Again, very attainable effect sizes when we include those baseline characteristics. Next slide. So what do we learn here? We learned that it's worth investing in collecting these pretest data and including it in your models. That is what buys you the most in terms of statistical power. And once you include that, you can collect household data, but it's too costly for the gains in power. However, if you do need the household data for other outcomes, you need to collect it. In our cases, in Leer Juntos, there was this community component, so we needed to collect the household data, which they had important outcomes, but it did not increase our power for reading outcomes that much. In contrast, school-level information may be a cost-effective way of increasing statistical power. Once you are in the school, because you normally go to schools to test students, collecting school infrastructure is not that expensive. And it could be a good way of increasing your power if you include those characteristics in your models. We have to keep in mind that these findings, our findings, are most applicable for schools in low to middle income regions, in LAC, and in rural or peri-urban areas. It might be different in high income countries or regions or in urban areas because you could have more variation on the household data in those cases than in our cases. And the school infrastructure may be more similar in those cases too. We're working on a paper to provide all these detail to education researchers. We will document all the ICCs and the R-squares we found because we think it's important information that will help them with their power analysis. And now I will turn it off to Emily that will discuss unit of assignment.
Thank you, Larissa. So as Larissa mentioned, one of the tools that we have in designing an RCT is determining the unit of assignment. And individual level random assignment can increase our statistical power. We need to take into account statistical power as well as factors around implementation when we're making the decision of what unit to use. For the evaluation of Espacios para Crecer in Nicaragua, there were more children that were eligible to benefit from EPC than could be served. Therefore, initially we planned to conduct child-level random assignment to both maximize power and to help the implementer meet the target number of beneficiaries. As the implementer gained a better understanding of how small some of the communities were, particularly those in remote areas, we realized that we needed to use community-level random assignment in those communities since a minimum number of children were needed to be served in order to be able to open and operate an Espacio para Crecer. Also, with such small and remote communities, we really couldn't justify withholding the intervention from just some eligible children in those communities. So it made sense to use community-level random assignment in those small communities and to continue using individual-level random assignment in the larger communities as there were more children that were eligible to benefit from EPC than could be served by individual EPCs. So we adopted a hybrid approach overall for the evaluation and intended to merge the two treatment and control groups from small and large communities for our analysis. We're really thankful that we did decide to use this hybrid approach as adherence to the experimental design in our large communities where we had individual random assignment was not as strong as we had hoped. we saw that group randomization can actually reduce contamination and facilitate program participation. In the large communities, as you can see in the right two bars of the graph on this slide, only 41% of the children assigned to receive EPC actually participated, and almost 20% of those assigned to not receive EPC participated. Therefore, the contrast in the large communities was not very strong and not as informative for the evaluation as we had hoped. In small communities, however, where we had used community-level random assignment, we had strong adherence to the experiment, as you can see in the left two bars of this graph. And we were able to estimate impacts in those smaller communities independently. We had not thought that we'd be able to do so at the design stage, since the assumptions that we had used in the power calculations were more conservative than in reality, but we're really glad that we used the hybrid design and were able to do this at the end of the day. I'll now hand this over to Julieta Lugo-Gil, who's going to talk about what we can learn from multi-site and multi-comparison evaluations.
Thank you, Emily. By conducting the evaluations in multiple sites and with multiple comparison conditions, we were able to have more opportunities to learn about when and for whom the interventions work, which in turn increased our confidence in the results and allowed us to contribute more to the evidence base and to provide more nuanced recommendations to stakeholders. In particular, by including multiple countries, regions, and communities in the evaluations, we were able to examine the effectiveness of the interventions in different environments for implementation and with different comparison conditions or counterfactuals. Additionally, the evaluations were powered at important subgroup levels, which enable us to estimate impacts at these levels and identify who benefited the most from the intervention. Knowing whether these impacts are meaningfully different for different types of beneficiaries is useful to better target programs in the future. In the next slides, I will give you more details about what we learned from conducting the evaluations of Leer Juntos, Aprender Juntos, and Amazonía Lee in multiple countries and regions. And my colleague, Sara Liuzzi, will talk about what we learned for key subgroups in the evaluations of educación and espacios para crecer. Thank you. Leer Juntos, Aprender Juntos was implemented in ethnically and linguistically diverse regions of Peru and Guatemala that have very different contexts for learning and for implementing the intervention. In this evaluation, we found evidence of impacts of the in-school component of the intervention in Peru, but not in Guatemala. It is possible that the differences in the learning environments and the prevailing practice in each country contributed to these different results in Peru and Guatemala. Specifically, in Peru, practically all the children in the sample attended preschool and started the first grade with oral comprehension skills in Spanish, which is the language of instruction in the country. And about 75% of the parents in the sample reported they can read. Also in Peru, the prevailing pedagogical approach was very different to the intervention. Conversely, in Guatemala, children were less prepared to start school, especially in terms of oral comprehension skills in Spanish, which, as I mentioned, was the language of instruction in Guatemala too. Also, the comparison condition in Guatemala included a prevailing pedagogical approach and several other initiatives that were all similar to the intervention and that targeted improvements in early grade reading. Then, it is possible we found impacts of the in-school component in Peru because children were more prepared to start school and also because the contrast to the intervention was stronger in this context. Next slide, please. However, despite the different environments and multiple contrasts in the evaluation of Leer Juntos, Aprender Juntos, we did not find evidence of impacts of the community action component of the intervention in either country, as Barbara mentioned earlier. A possible explanation of this result, which Barbara also mentioned before, is that there were challenges to the implementation of the component in the two countries. Some of these challenges were similar. For example, in both countries, the implementers found very difficult to recruit and to retain the volunteers that were supposed to facilitate the activities of this community action component. Also, some of the implementation challenges were specific to each country. For example, in Peru, the implementation of the community action component was delayed, and some of the components, or one of the main components of the community action component was folded into the in-school component so that teachers were actually providing those activities. In Guatemala, there were barriers to participation in the activities. Specifically, parents reported that the inclement weather and the high transportation costs made it very difficult for them and for their children to go to the activities offered by the community in the evaluation. Next slide, please. In the evaluation of Amazonia LE, we also learned that the comparison condition is quite important. Amazonia LE was implemented in 2 departments in the Amazon region of Peru, each providing a very different contrast to the intervention. In Ucayali, the intervention group was compared to a condition that did not receive any additional support beyond what the Ministry of Education typically provides. So this comparison condition did not include any other intervention similar to Amazonia LE. We found evidence of impacts of the intervention in Ucayali. Conversely, for San Martin, the intervention was compared to a group that received additional support from another similar intervention called Soporte Pedagógico. In San Martin, we found that the Amazonia LE intervention was equally effective than Soporte Pedagógico. So we think we found evidence of impacts when the intervention was compared to a no intervention condition. Now I will hand over the presentation to my colleague Sara Liuzzi, who will discuss educación en espacios para crecer.
Thank you, Julieta. So I'd like to describe first how we designed our study in Honduras of educación to allow us to learn about more than one intervention by using a three-arm design, and to learn about those interventions' impacts in more than one population by drawing our sample to include multiple subgroups. We tested the 2 educación interventions in both urban and rural contexts. This first intervention used the results of end-of-grade assessments to develop and implement a school action plan, and this work was done with principals. For the other intervention, teachers administered monthly formative assessments and use these results to develop and implement classroom improvement plans. This work was done with classroom teachers. Using our three-arm design, we estimated the impact of each intervention separately. We also compared the impacts of both interventions in urban areas to impacts in rural areas because we hypothesized that important differences in these contexts could influence the impact of the interventions that we were studying. What we found was that the end-of-grade intervention had significant impacts in urban schools, but not in rural schools. We think this may be because principals in rural schools often also work as classroom teachers, leaving them little time to use the end-of-grade test results to develop and implement a school action plan. Furthermore, working with the end-of-grade test results might have been more important for principals at large schools who had more classrooms to manage. For the formative assessment intervention, which relied on an active role of the teacher, we found large impacts in rural schools, but no impacts in urban schools. A key difference between the urban and rural context is that urban teachers are much more likely to work in more than one school, limiting their time available to develop and implement a classroom improvement plan. In contrast, the rural teachers have more time to dig in and implement those plans. The Espacios para Crecer, or EPC evaluation, was implemented in rural, coastal, and island regions of Nicaragua, and we were able to assess impacts for both large and small communities separately. These groups of communities were different. The smaller communities were more rural and in general had poorer outcomes than the larger communities, where students had more opportunities for things to do outside of school, aside from participating in the EPC after-school program. Many small communities were much more isolated. To give you a sense of how hard to reach some of the communities were, this picture on the screen now shows one of our enumerators on the way to a small community for data collection. What we found was that in small communities, EPCs had positive impacts on some child reading outcomes, but in large communities, there were likely no impacts. And we believe this variation in impacts is likely due to contextual differences that can affect beneficiaries' take-up of the intervention and also potentially the impact of the intervention itself. Across our evaluations, we found that using 3-arm designs and drawing our samples to allow for learning in multiple contexts were both really valuable and helped us learn more from each of the evaluations. And now I'll hand it over to Emily to talk about cost effectiveness.
Thank you, Sarah. I'd like to talk a little bit about the cost effectiveness analyses we conducted or were mandated to conduct for the 4 impact evaluations. Our goal was to estimate the cost effectiveness for an increase in reading skills as a result of a single program, to reflect the cost to achieve impacts over and above business as usual. The goal was to estimate the marginal cost or the cost to provide services to 1 additional child if the program is operational. Our mandate to conduct cost effectiveness analyses was not able to be implemented in the same way for each of the 4 evaluations, as Barbara noted at the beginning of this. This is largely due to the availability of cost data. We use financial cost data where possible from program implementers. We still sometimes need to incorporate assumptions such as the distribution of costs from across research realms, but we want to use exact numbers from components. Our framework used activity-based costing or an ingredients approach to cost estimation, in which we take inventory of all of the major investments associated with the program or intervention, including labor and materials. Where it wasn't possible to do that, we were able to use high-level estimates of costs such as costs to scale an additional portion of the intervention to more beneficiaries from the implementer, or overall contract cost. This doesn't include the ingredients, is not as detailed as an ingredients approach, but it can still be informative and give us a sense of the overall cost of the program. Finally, it's clear from this work, it was sometimes infeasible to collect cost data. It's just sometimes not possible or practical to do so to conduct cost effectiveness analyses. In Amazonia Ley, it was not feasible to collect the required cost data for a variety of reasons, so we don't have those estimates for that evaluation. Regardless of the approach to costing that is used, it's important to calculate the correct number of children who are affected by each intervention group in order to convert total costs to cost per child to ensure that costs are measured in the same units as the impacts. So on this slide, I just give you a summary of the costing that we did for each of the 3 evaluations where we did cost effectiveness analyses. We used an ingredients approach for Leer Juntos, Aprender Juntos in Peru and Educación in Honduras. Costs were mostly made up of personnel salaries and benefits, as well as of travel costs associated with sending technical staff into the field to conduct trainings and coaching. Other costs included educational materials and supplies. In Nicaragua, we weren't able to use an ingredients approach, and so we used 2 different high-level cost estimates. You can see that the marginal cost or the marginal cost per child varies for each of the projects and for each of the approaches in the case of Nicaragua, where we have overall costs that include program design and startup in this higher estimate. And then we look at the cost for the implementer to open a new Espacios para Crecer from within the existing project in the lower estimate. So we use this cost per child number, and we estimate the cost effectiveness, which is the cost per student of a 0.1 standard deviation increase in test scores. On this graphic, we're showing you our cost estimates compared to estimates from other education programs in the LAC region. The LAC READ studies are in dark blue, and the other studies that we found in a published review are in blue. Our estimates suggest that the LAC READ's interventions were within the range of other educational interventions implemented in LAC to improve student performance, which is really heartening given that these were the hardest to reach populations in each of these countries. It's important to remember that the costs do reflect different states. We are clear about this in our evaluation reports, letting you know whether it's the cost to scale or cost at steady state versus including startup costs. But as a researcher, I just like to note that sometimes it's really hard to tell in papers precisely what costs are and are not included. So it's really good to look at that when you're comparing the costs of different types of interventions. We think these results are informative to a range of stakeholders, including contributing to the literature. We know USAID and LAC RSD learned from each of these evaluations, and the ministries in Honduras, Peru, and Guatemala were very involved in this process. One of our takeaways from this overall effort is that policymakers and program implementers should consider testing innovative, lower-cost ways to effectively deliver program elements, such as in-person teacher training and coaching. So I'd like to just discuss a little bit some of the challenges that we had in conducting cost-effectiveness analyses. We were mandated to do this as a part of the LAC READ's evaluation contract. We were working with USAID, who was really invested, in seeing the findings from these, and we still had some challenges across the board. So costs are often tracked differently than how we would like to see them, and it can be challenging to get information from different administrative systems. Even if we're using templates and preparing from the beginning and working closely with implementing partners and the funder is on board, to follow the ingredients approach, we need the marginal costs, which can be hard to do depending on how they're tracked in existing systems. Actors are often tracking data in systems in different forms, and so we have to work with each implementer, each partner to get those cost data. And sometimes you'll see interventions have multiple implementers, and it can be hard to combine from across different systems. The systems issue results in additional costs to conduct the work, not only on the evaluator side. The onus is often on the implementer to sort through their systems and pull the information out and produce costs that are in usable form. This can be even more challenging sometimes when working with the Ministry of Education, where it can be even harder to get the data. Due to these challenges, cost effectiveness analyses definitely we think need to be mandated and in order for them to happen in evaluations. We found in this evaluation contract that even when it's mandated and the donor is supportive and we are working closely with implementing partners and have strong relationships there, it can still be really hard to do. Indeed, sometimes it's just not practical. Fortunately, USAID Education now has new costing guidance for all education projects, which will be really helpful to building the evidence base on the cost effectiveness of USAID education programs that are evaluated moving forward. This will help to address many of these challenges in future evaluations of USAID education programs. Also, as a reminder, it's important to communicate what existing investments or infrastructure exist to sustain the program when we're producing cost effectiveness estimates. So are the estimates reflecting startup costs, what it costs to go from zero to a program that's operating? Or does it reflect steady state costs where you're taking a system that is already working and then you're expanding and doing more to it? Such information can really help inform thinking moving forward around these interventions. I'd now like to hand this over to Dan Levy, our discussant. Thank you.
Thank you so much, Emily and everyone. Welcome everyone to the Q&A session. I want to offer a few remarks, but I want to make sure that you all feel free to ask questions. I know a few questions have been coming in the Q&A, but please feel free to add now. I want to begin by just a big praise of both the funders and the implementers of this evaluation. Michael and Barbara, I thought your remarks at the beginning were an example of, I think, how agencies commissioning evaluations should approach doing this. In particular, a lot of impact evaluations come without considerations of costs, and so we're often left with a feeling, okay, this program had an impact, but at what cost, and is it worth doing? And I think your insistence of doing this, and this, according to what you said, being the first evaluation where this was done from USAID, I think it speaks highly of your leadership of the project. I also want to say the intellectual honesty, both of the implementers and also of the funders, of just sort of saying when things didn't work, the community action component did not work, and just asking, okay, what could have gone differently, or what we could do, or what are we learning from this? I think it's, again, an example of how it should do. And then on the implementers of the evaluations, the Mathematica team, I think for those of you in the audience who haven't done an evaluation of this kind, it might be difficult to appreciate how massive of an effort this was. These were many impact evaluations, many cost effectiveness analysis. And I can say from experience in having been involved in some similar work, every slide that they presented, I think their blood, sweat, and tears behind them in terms of how much effort it took. And I particularly appreciated the careful attention to measurement issues, which often don't get addressed in impact evaluations as carefully as I think they should. And with documenting the counterfactual, I think this is a really, really very important aspect to understand the findings of the evaluation, to understand the context, and to try to generalize from it. And I think for that, you need careful attention to qualitative work and careful attention to understanding what is going on in the field. And I thought that was done superbly in this set of studies. So I want to ask a couple of questions and then invite and please invite everyone to come. So one question that I have, and this might be a question for Barbara maybe, is cost effectiveness analysis, as Emily just pointed out, they're very hard to do. They're not, they're just not something that you just tag at the end of an evaluation, just say, all right, let me just do this in a couple of weeks. And I wonder if you could reflect a little bit, since this is now becoming a standard part of your projects, if you can explain a little bit how you're thinking about this in the scenario, because they're, impact evaluations in general can end up saying this program had a statistically significant impact. And then the question becomes, okay, given this impact, is it worth the cost? But some impact evaluations find no evidence of impact. And I wonder if you can reflect a little bit about how, in practice, you've been able to do this cost effectiveness analysis under the scenarios that are most relevant.
So Dan, I'll try to address that. I wish that my colleague who's been leading the cost analysis effort in the agency could also help respond. So for these LAC-READS evaluations, we didn't do a cost-effective analysis when there was no impact because it didn't make sense to do one. Yeah. For the agency effort that's been put in place, it's more about collecting cost data, not necessarily cost effectiveness analysis, but knowing what our interventions are costing, so that we both can understand that, not just at that level of what's the award cost, but be able to tease out where the monies are going in a more meaningful way that can be looked at across projects and can help with thinking about scale up. And then that same data, when there has been impact evaluation that shows impact, could be used towards cost effectiveness analysis. But as an agency, we also think it's important to be able to just compare costs of interventions just have that data in a comparable way where we can think about how different interventions cost differently. And it also can help us to understand where things are expensive and whether we need to be thinking about doing it differently, and gives us data we can share with other stakeholders who might be wanting to scale up. Over.
Thank you. Thank you, Barbara. Okay, so one of the things we're going to try, for those of you who are here with us, is get a sense. There are several questions in the Q&A, and just get a sense of what your level of interest are in the various questions. So if I could ask Matt to launch the poll. This is just for us to be able to decide which questions we give higher priority. So if Matt or anyone can launch the poll, that would be great. So we'll wait for a few seconds while everyone has a chance to respond to the poll. But maybe while responses are coming in, I want to maybe start with a question from Lawrence Aber from New York University. He's asking the question whether you, and I think it refers to the Mathematica team, have examined impact heterogeneity by variables measured at baseline. So today was a fairly high level presentation, but I think he wants to know a little bit more about whether you have examined subgroups in particular in any of these evaluations. So whoever from the Mathematica team wants to start answering that question, that would be great.
Hi, Dan. This is Larissa. I can answer that question.
Great.
So these evaluations, all of them did a subgroup of comparing impacts, calculating impacts in girls and boys and comparing those impacts. Those, I think, were very standard across all evaluations. And then some evaluations did different subgroup analysis, right? For example, Sarah discussed, or Julieta discussed a little bit of the subgroup of urban versus rural in some cases. Those were the main subgroup analysis we conducted, but because we were powered for full sample analysis, we didn't conduct a lot of subgroups. Just the only one that was standard across all was gender, and in some cases the urban rural, because it made sense.
Thank you so much, Larissa. And that actually, your response links to a question asked also in the Q&A by Clara Pava from Save the Children, and a former student of mine. So hello to her. Which is whether you consider doing Bayesian analysis that you have used on other projects. I think Emily might be the person who has done this for studies that were either underpowered, or in the case that you just responded, the study was well powered, but perhaps not powered enough to do a lot of subgroup analysis. So I want to invite, I think Emily's the one who did this study with the Bayesian analysis.
Yeah, thank you, Dan. I can speak a little bit about the case of Senegal and why we use Bayesian analysis there, which is a little different than what we normally do, like in this evaluation, where we take a frequentist approach. We're looking for, at the end of the intervention, after a few years, what is the impact of the intervention on your key outcomes of interest? As a part of the Rapid Feedback MURAL project that USAID has, Mathematica is working with Results for Development and other organizations to work with projects to do more rapid, use research methods to give more rapid findings on whether or not things are working. Rather than waiting 5 years for the project to be implemented, let's look after 1 year of implementation or 2 years of implementation and see what's going on there. And in that case, with the goal of doing things rapidly, we're trying to use data that exists already and not do a separate, independent, large data collection effort with a study that's statistically powered to get where we want to go. Basically, we're trying to use what we have on hand to learn something from the data that exists to help inform short-term decisions and maybe some longer-term decisions. And so in Senegal, there was random assignment was used to determine who was going to be receiving this community engagement as component of the intervention. And the administrative data existed in such a way that we were actually able to use them to do an analysis. So we had an RCT, we had the counterfactual, and we were able to increase the administrative data sample size for the EGRA that was collected by the implementer just a little bit and be able to draw some lessons from that. And I think that that case is a little different than here where, and maybe Barbara, you want to add to this, but here we want to look at the effects of the interventions after they've been in the field for a few years.
Great, thank you. Thank you so much, Emily. I want to comment the results from the poll. It looks like over 50% of the people in the audience want to understand more about the evaluation policy implications. But yet most of the questions that are coming on in the Q&A are questions about methodology, which received 25%. So I'll try to strike a balance between the overall interest and what the questions are saying. But if you have a sort of a specific policy implication question, please let us know. So I'm going to preview for the group so that you can start thinking. I want to ask a general question about what you see as the one or two most important policy implications of this sort of study in terms of what happens in the field. But while you think about this, I'm going to ask one of the methodological questions to you. So Ryan Moore from MCC, also former student. No favoritism here in picking the questions, but it is a good question. So, Larissa, you mentioned that adding baseline household characteristic didn't add much power, and Ryan wants to try to understand how generalizable you think that finding is to other similar studies.
Yeah, so I do think we have to be careful with that. The reason I think we didn't find that the household variables explain a lot is because in these contexts, there was very little variation in the household data. So there is correlation with the outcomes, but there was not huge variation. In other contexts, there might be correlation of the household with the outcomes, but also more variation in the household, like in urban areas or in developed countries. So I do think in those cases, the household could explain more than in these cases. Yeah.
Great. Thank you. Thank you, Larissa. Okay, so there is a policy question that is being asked by Steve Glazerman, who I understand was very involved in this project. And so I want to sort of showcase his question. First of all, he praised you for the presentation, and then he sees, what do we know about how the findings have influenced policymakers or educators in any of the countries where we did this work? So I don't know who wants to take on this. I don't want to put anyone on the spot, but I'll let you decide who wants to take this question. So how have the findings affected policymakers or educators in any of these countries?
I can speak somewhat to this, and if Michael's still on, I'm going to ask him to maybe bring in a little bit about the work under Lac-Reed's capacity. But COVID has put a bit of thrown a monkey wrench into this. One of the countries that was very much using the data was using the impact evaluations was Peru. The regional governments were very interested in carrying on some of this work, even though USAID was no longer funding them. But with the pandemic, where things have, they're not able to keep doing this work right now. That area is very much influenced by the pandemic and out of school, and is not technologically advanced enough to be able to use this work in distance education. As aid as our project, we've had a complementary award that's around capacity building to use evidence. And that has worked with stakeholders in different countries to use evidence generated by these evaluations and other evidence to help those stakeholders strengthen what they're doing. And if Michael's available to speak to this, I invite him to do so. But those are the examples I can give you right now.
Yeah, thanks, Barbara. That's pretty much right. I think it's a great question, and it's a tough question for us. It's one of the harder things for us to gauge, especially for Barbara and myself sitting in DC, and over the past year or so of pandemic times where we're not able to travel or see what's going on in the field. But one of the interesting aspects of the LAC-READS capacity program, that I don't know how explicitly we brought it up, is that all these programs are funded by aid and implemented by independent nonprofit actors or implementing partners. They're not government programs, and as such, it's challenging to get others' attention, and perhaps that's for good reason. The most interested stakeholders, generally speaking, are the direct beneficiaries and the implementers of the programs. And then where we want to encourage scale up of either whole programs, or parts of programs, parts of interventions, I think that's where we've had some more interesting conversations, and that's where the cost effectiveness components have been so grounding, and it's where the impact, it's where the ability to show disaggregated impact has been so valuable, to have a very informed evidence-based discussion with people that care about this stuff and are looking at all options on the table. The LAC-READS capacity program that Barbara mentioned has been useful in sort of socializing and disseminating not just the Mathematica research, but also all their available research. And they did a really valuable landscape analysis, among other knowledge products that brought to basically, was the most comprehensive effort of its kind in the region to look at all the relevant literature, from gray literature to RCT level type work on this topic, and that's a really valuable document for anybody that's interested. You can find that on lacreads.org. Reach out to us and ask for it if you have any trouble. But yep, this is an important question, and thanks, Steve, for asking it. Hope we can continue to figure out ways to answer it.
Thank you, Barbara and Michael. Anyone from the Mathematica team wants to add? Please jump in the next 4 seconds. If not, I'll move on to the next one. Okay, so I have a question about for the cost analysis. I think pointed out that these are costly interventions in part because some of them are done in very rural areas, and because a lot of these interventions are interventions mediated by teacher training. I wanted to ask your sense from anyone involved of, particularly now after COVID, of the possibility of doing at least some components of this intervention, like the teacher training, through ways other than physical. So, for example, through online means. Is this something that's just a pipe dream because the technology is not available, or is this something that you think could be done to reduce the cost of these interventions? And the difficult thing about
Speaking for USAID, I know this is something that our USAID colleagues in the missions are all looking at very carefully as they're considering how to program going forward.
Great.
We're not looking at this moment at the evaluation piece. We're more concerned about making sure we can get continuity of education and resilience of education systems.
Sure. Great.
Yeah.
Thank you.
And I want to add to Barbara's answer just really quick, and I want to hear the more informed answers. But there has to be a way, right? There simply has to be, and I think that's what everybody's trying to figure out is how can we do it how can we engage in those type of activities in either hybrid or virtual ways. But let's hear from folks that looked at this carefully.
Yeah, I'd just like to jump in and add that I think that there's a lot of learning happening right now during COVID on ongoing projects to see what can be done remotely. The Senegal intervention that I was speaking about earlier that we're working on for RF Merle, they had to pivot and go from in-person annual teacher training to virtual teacher training. And they developed new materials and are using text messages and all sorts of different approaches that they had already included in the intervention in different ways, and we're just beefing it up during COVID. And I think that we'll learn a lot from those experiences in the near future, just based on their ability to reflect on what they did this school year and what worked and what didn't.
Thank you, Emily. Speaking of that, Fabricio Balcazar from the University of Illinois at Chicago asked, do you have any information, and this is not directed to you, but since you mentioned COVID, do you have any information about the recent impact of the COVID pandemic on the program's implementation?
So I think for ongoing projects that I'm working with for different evaluations, we're seeing delays and challenges across the board, in a myriad of ways. Whether or not that affects, what we can see in an evaluation at the end, to see, what we can learn from how implementation had to change and how might that affect learning. I mean, we know we're dealing with learning loss, right? But I think there's still a lot that we need to learn to do to understand the full impacts of COVID.
Got it. Okay. I want to move to a question that came through Michael from Katie Annis. And in the evaluation, you pointed out that the community action component, the exact note in the slide said the lack of impact of the community action component. And I think her question boils down to it didn't work for this evaluation, but yet there's a lot of evidence that early childhood interventions that help children read can work. And so it's a question about the external validity. To what extent you think your finding of lack of impact of community action component is generalizable to other contexts or to the same context for different age groups. I'm not sure who wants to take on this question, but welcome anyone.
Dan, maybe I can kick us off in responding to that question, which I really appreciate. I don't think any of us believe that community engagement is unimportant. And in fact, I would say engagement of parents and kids outside of school, right, in supporting and fostering reading is critical. I think what we can say about these two evaluations is the intervention, the way it was designed and or implemented in these two contexts, right, didn't achieve the desired impacts. I don't think in any way any of us believe that that means we would generalize these findings to the entire concept of parental engagement and increasing time on task and reading outside of school. But I would invite the evaluation leads, Julieta and even Barbara, to maybe chime in here, because I feel like even the implementer said that, right? It was very valuable to test this particular intervention in two very different contexts and hear that it didn't work. But that doesn't mean that they believe community engagement doesn't work. They just didn't find the right recipe, right, for these two places. But some other thoughts. Or Barbara.
What I can add there is I think in my presentation, one of the takeaways I was hoping to communicate, I hope I succeeded in communicating, was in fact that we still think that something like community engagement could be a very valuable approach, and that it's worth testing other ways and figuring out what works in different places as a relatively low cost way to help kids add value that will help kids learn more than we can just working in schools. We recognize that there were issues in this particular evaluation implementation of that component that don't signal a generalizable finding.
Thank you, Barbara.
I can also add that for the evaluation of Leer Juntos, what we tested was the effects of the community action component together with the in-school component. So what we did not find was impacts of the community action component above what the in-school component provided. So this means that the two components are not additive. The two components are linked, and we just didn't find the impacts in particular for the community action component in this particular evaluation.
Thank you, Julieta. I think this is a very interesting question. I've been involved in evaluations involving community component, and I can't help reflecting myself on this question, which is reinforcing what Nancy said, which is no one doubts that community involvement is important. I think the question is whether an external agent can inject an intervention that mobilizes community in a way that translates into impact, and that is a much harder question to answer. We only have 1 minute left, and I want to bring this part of mine to a close before giving Barbara the last word. I do want to say I've never been part of an event like this where every single presenter hit their time limits like clockwork. So I want to do my part of this and just congratulate everyone for wonderful presentations and for being so rigorous in your practice to make sure that this went as clockwork as it did. So Barbara, please, you have the last word. A pleasure to be here with all of you, and I hope you have a good rest of the day.
Hello, everyone. Again, I thank you for attending and for your interest. We've been really excited to share this information that comes out of a long stretch of work. And we invite you to, on the event website, there are links to various documents related to this. And you can also reach out if you have questions or want to engage further around this topic. So thank you again. And the recording will be made available and the slides will be made available. You're welcome to share them with colleagues that weren't able to be here today.